always ask, well, when did I know I wanted to become a doctor, and how did that happen? What were the circumstances behind it? And interesting, I was looking through some of our old paperwork boxes that were, in the house where my mom and dad had that I grew up in, and I found when I was in 6th grade. And there was, in that class, it said, what do you want to be when you grow up? And at that point, I said, a doctor. I had an uncle who was a doctor, a general practitioner, and back then when he was a doctor, they did surgery. And I used to go to his office as a young boy, help clean the office, but then I used to watch him hang out with patients, and I really loved it. So that was my initial introduction to, wanting to become a doctor. And of course, my mom said, honey, it'd be great if you became a doctor. Then my sister Alexis started on that train too. But so initially, I kept with that thought, and for some reason, it just resonated with me. I wanted to be a doctor. I wanted to take care of people. And then I went and found more papers in 11th grade in high school, and it was my English class, and it was a whole essay about what's your future going to be like, and it was about being a doctor. So it progressed. At that time then, I wanted to go pre-med, and I applied to 5 good colleges that were good for pre-med. And I ended up getting into all of them, thank God. It was so cool that I was able to choose, and I went to the University of Southern California. And I ended up going pre-med and also getting a business degree. And that, college life, it was interesting because you're doing pre-med, you're doing business, then you have, the fraternity life and all that. And I was able to put it all together to start learning how to multitask. From that point on, the next step is getting in medical school. How do you do that? And, back then when I applied, you had to do research, you had to do volunteer work in doctors' offices or emergency rooms, and you also had to have really good grades. So in regards to the research, I met a famous doctor named Dr. Howard House, who was an otolaryngologist, and subsequently that's what I became later on, an ear, nose, and throat doctor, who was the founder of an incredible ear hospital called House Ear Clinic and Institute. I used to watch him operate while I was going to college, and I started doing some research, because you need research when you want to go to medical school. And that started me on the track. In addition, I volunteered at a few different hospitals in the emergency room and worked late at night on Friday and Saturday night. Especially I remember one called the California Hospital in downtown Los Angeles. So every night I worked there, there was always, excitement, a lot of trauma. So I learned a lot. And I did pretty well in school. And then finally what happened was I ended up going to medical school, and then the next question is, always asked, is why do I want to become a facial plastic surgeon? So I got in medical school and did my training, and eventually I fell into that, specialty that I loved, which was otolaryngology. It's something that I always loved, and that's head and neck surgery because the anatomy is fantastic, it's incredible, and it's really hard. And there's a lot of great surgery because I love surgery. I applied for different residencies, and I ended up meeting a friend of mine at a medical meeting that I was lecturing at, and he was going to the University of New Mexico in Albuquerque, New Mexico. Never even been there. Maybe drove through it once. And I went there, and at that time they had 1 resident a year with 6 different attendings, which means, when you're at that hospital, you're it. So you do big surgeries at the beginning of your training, and so I loved it. So I spent 5 years, 1 year in general surgery as an intern, 4 years in otolaryngology, and during that training, numerous things happened to me to steer me into facial plastic surgery. Number one, I did a rotation with the doctor out there named Dr. Carl Eisbach, who was a wonderful and incredible facial plastic surgeon, faceless and eyes and noses, and I loved it. And I said, this is something that I really can see myself getting into. It's wonderful and interesting surgery. In addition, there was a young boy who unfortunately got attacked by a bunch of Rottweilers. And we and my team were involved in his reconstructions, especially at the scalp and his face. And I remember that little boy who was always in great spirits, no matter what was happening to him. And we did all these surgeries, and we actually took, unfortunately, I still remember, thinking about his face and what he looked like to when we finished. And there was a significant improvement. But unfortunately, he still was always going to have these scars on his face. And so that was really the solidifying aspect of my training that steered me into facial plastic surgery. And to finalize with that, then you apply for a fellowship. It's 1 year. And I did all my fellowship interviews, and I met this incredible doctor in St. Louis, Missouri, named Dr. Regan Thomas. Such an incredible surgeon and person. And I loved working with him for that year. And I learned everything from how to do facelifts, an incredible way, rhinoplasties, scar revisions, reconstructions after having a cancer removal on the face. And that really led me into, getting an excellent training. And that finished in 1998 in the summer. Then I came back to California and I started in facial plastic surgery. Did my parents have any influence on my path to becoming a doctor? Yes, my mom and my sister did. My mom, Ann, my sister, Alexis. Obviously, I always wanted to do it since the age of 6 because I just felt like this is what I want to do. But of course, the two of them kind of helped me and urged me into it. And of course, I thank them for where I am today. My sister still reminds me, it's because of me. And my mom, God rest her soul, I still think about some of the conversations we used to have about my career, especially when I was in high school. I'm always asked, what surgery do I enjoy the most? Revision rhinoplasty, and let's talk about that for a minute. When I finished my fellowship, I was trained in primary rhinoplasty, first time. And I really didn't know a lot about revision rhinoplasty, so when I started my practice, I started reading, watching videos, go to different doctors that were specialists in revisions and learning and watching, and pretty much taught myself. And especially when you learn when you learn to operate, and then you see what happens for a rhinoplasty, for example, doing a small maneuver today can have devastating results, like taking away some of the tip cartilage to make the nose smaller. This can cause destruction of what we call the valves of the nose and make the nose look great. That's exactly what happens now on Botched. You see some of these rhinoplasties, even with a good doctor. Even it happens with me. You see complications later on. So I've learned over the years, and it's been since late 1998, early 1999, since I started practice. And if I have to, think about it, I probably have performed over maybe 25 to 30,000 rhinoplasties at this point. And then, of course, doing facelifts and brow lifts and blepharoplasties and fat grafting and neck rejuvenation. It's really an incredible field of facial plastic surgery. So if I had to guess how many total surgeries I performed, it probably has to be 30 to 35,000 procedures. That's just after I finished my fellowship. Because then when you're in residency and fellowship, you're also operating quite a bit. The hardest plastic surgical procedure, especially if it has a lot of complications, is rhinoplasty. The hardest of the hardest is revision rhinoplasty, and that, of course, is the surgery that I enjoy the most. That's what I specialize in. Yes, I do facial rejuvenation. I love that. As a matter of fact, I'd say 65 to 70% of my practice is nose, and the rest is aging face surgery. In addition to all the nose procedures, I'm going to say about 70% of my noses are reconstruction and revision rhinoplasty, and the rest of it is first-time primary rhinoplasty. What is board certification? So, plastic surgeons and facial plastic surgeons are different. And when you go to your board, each group has their own board certification, which means you have to pass all these tests and exams and do specific things in your training to get board certified. So for facial plastics, we have the American Board of Facial Plastic and Reconstructive Surgery. And I'm certified by that board. In addition, I'm also board certified in the American Board of Otolaryngology Head and Neck Surgery. So I have 2 board certifications. So when you are board certified, it means you went that extra step to become board certified in your training. You can also be board eligible, which means you've done most of the things to become board certified, but you just haven't went to that next step. Many times I've asked, what's a cosmetic surgeon? What's a plastic surgeon? What's an aesthetic surgeon? And in many states, many doctors that are not plastic surgeons, facial plastic surgeons, oculoplastic surgeons, or derm surgeons can do other types of cosmetic procedures. They can go to a meeting and learn how to do liposuction, for example, over a weekend. And so some of these doctors that are not formally trained can call themselves aesthetic or cosmetic surgeons. I call myself a facial plastic and reconstructive surgeon. I can call myself a cosmetic or aesthetic surgeon, but I usually don't use that terminology. So what's most important is when you're going to go to someone who's in the field and you want to, for example, have a rhinoplasty or a breast augmentation. You want to find out, is that doctor board certified in that field, in that specialty? Is that doctor a board certified plastic surgeon? Or is that doctor a board certified facial plastic surgeon? And for example, of the face, those 2 types can do that, or oculoplastic surgeon, or some of the great derm surgeons. So you have to see what the board certification is. In addition, once you find that doctor that's board certified, can that doctor do that procedure in a hospital? Do they have credentials in a hospital? Very important. And lastly, you want to make sure that doctor does a lot of that procedure. You want to make sure that that doctor is a specialist in that procedure that you are going to have performed. What made me start a fellowship? When I finished otolaryngology, I was trained in facial plastic surgery, but not enough that I felt comfortable that I said, I need to go out and get that additional year. And many plastic surgeons and facial plastic surgeons will go out and do a cosmetic and reconstructive fellowship. So I felt that getting and doing that fellowship was something that was very important for me to get that extra training, because what happens is you do a year and you learn from that doctor who's been in practice for whether over 25, 30 years, you kind of maybe gain about 5 years of experience. And that's what I did with Dr. Megan Thomas in St. Louis. And it was one of the most rewarding experiences of my life. And I always thank him as being my mentor. And we're still in contact. And we still talk to each other all the time. And as a matter of fact, now I have my own fellowship. I think we've had it for 11 years. Dr. Azizadeh and I, we have a fellowship together. And we have 2 fellows per year. And those fellows now, just like what happened to me, they come to me, they spend a year, and they learn about surgery and complications and patients and everything. So fellowship training is very, very important as part of our curriculum, and actually, for treating everybody. Why did I start a skincare range? It really started with me operating on my patients, especially the facial rejuvenation patients, and knowing that I can do a great job with the scalpel. I can do a nice lift and take care of the eyes, but it doesn't treat the skin. So the face was looking great, but the skin wasn't looking great. And I thought about really what is the best way to take care of the skin and get it ready to get it prepped before surgery. And I always think about exfoliation and hydration. And exfoliation, you want to get that layer of dead skin cells off the face. You want to have deep cleansed skin. You want to have clean pores, especially when I'm doing rhinoplasties and I see all those blackheads. And I said, what can I do to prep the skin? So we worked on exfoliation. Then hydration. We noticed that when we operate on patients that are dehydrated, especially their facial skin, the skin isn't as pliable. And when we're operating, it's actually more difficult. So we started hydrating the skin with different skincare products that I was working on for years, and exfoliation, and the skin was actually easier to operate on. It was more pliable in surgery. It's almost like peeling the skin off. I know it sounds kind of graphic, but a raisin as compared to a big, beautiful green grape. Think how easy that is to peel the skin off the grape as compared to a raisin. And then we started thinking about, okay, well, we got exfoliation, and then we have hydration, and we love antioxidants to actually make the skin look better and more bright, and decrease fine lines and wrinkles, help with the texture, get those pores small, help with the tone of the skin. So we started making a small line of products for the patients to use 1 month before surgery. And that was important to get the skin prepped. And we want to make sure that every patient is prepped prior to surgery, so when we operate, everything is just easier. And the patients are happier when their skin looks great. I'm always asked on interviews, where did the show Botched come from? How did that, happen? And it was interesting. I was having dinner with the two executive producers of the old Housewives show. We were having dinner and said, it's time for a plastic surgery show. And I remember, one of the producers, Alex, and I talking, maybe we should think about taking patients that have devastating results and show them, talk about those problems, and then fix them on TV. And, but of course, one of those things are, well, what happens if the results don't come out? Great. I said, okay, that's something interesting because, we want to show everything what really happens in surgery and with patients and complications and issues and patients with psychological issues, body dysmorphic disorder or OCD or plastic surgery addiction or going too far. So at that point, I called my good old buddy, Terry Dubrow, and he said, and he was sick at that time, he had a cold, and he goes, that's the stupidest idea I've ever heard of. We're going to take these patients that have very bad plastic surgery and the tissue's not great and try to fix them and put them on TV. And he says, all right. I said, let's do it. Let's take a shot at it because you know what? It's something that no one's done. So we did a little sizzle reel and we just talked and looked at photos together. It was about a 3 or 4 minute reel. And I remember the E! Network saw it and loved it. And we said, we're going straight into production. And now, thank God the show is doing fantastic. And, it's really based on a few things. One, a human interest story. Taking someone who basically their life has been ruined or had a major problem and making them better as best as we can. So that's great. In addition, it's a cautionary tale. We're educating, we're teaching. For example, don't have illegal substances injected in your body like silicone. And we're showing the different patients, and it's entertaining, that have had these crazy experiences in their life from all over the world. And when we first started doing Botched, we had, I think for the first season, 500 people apply for the show. Now we have over 10,000 apply each year through our casting department. And of course, it's a relationship, between Dr. Dubrow and I. So all these have put Botched together and I think made a fantastic show. And at the same point, it's educating. Hopefully it's going to prevent, if it prevents one patient from having a problem because they learned something on the show, then we did our job. And especially when you make someone happy. Did Botched make me a better surgeon? Obviously, of course. And the reason why is I've always done revision surgery and I had hard cases. But with Botched, it exposed us to the most difficult cases in the entire world. Some of these patients I would never dream of operating on. As a matter of fact, in the beginning, when they used to bring us these heart patients, we would usually say, Dr. Dubrow and I, no, 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 yes. And then after years of experience, now it's usually yes, 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 no. So my experience level has increased. My dealing with skin that doesn't have great blood supply called ischemia. I'm very familiar with dealing with that. It is high-risk surgery. Sometimes it's not predictable, but it has made me a better surgeon. Plastic surgery is always evolving every 5 to 10 years. Back when I first started, it was the scooped out, pinched overdone rhinoplasty, or the facelifts with a pull like this, or eyebrows too high. Or that was in the beginning when I first started my practice. Then we started becoming more natural. We're starting plastic surgery a little bit earlier. And then we went through stages where everyone was getting their lips too big and their behinds, put a lot of fat in there called Brazilian butt lifts, and getting too much filler in their face. And then we have the selfie dysmorphia, where you're taking selfies and filtering out your face to make it look unrealistic. That might also cause a little bit of body dysmorphia. And so our field is constantly changing. But the goal is to get patients to always look good and natural. Sometimes it's not just cosmetic, it's reconstruction. We want to make sure patients are realistic, and we like to give natural results. Not faceless like this, but more lifting the elevated and tying the neck, or gentle elevation of the eyebrow, or repositioning of fat in the lower eyelid. Restorative, giving volume back to the face. So if I can do everything all over again, would I still be a facial plastic surgeon? Of course. I love this. Would I still have a skincare range? Yes. I love taking care of skin. I love talking about the science of all the key ingredients that we put in every one of our products. Would I still want to be on Botched? Yes. All these, nothing would change. I love what I'm doing, and I love where I'm at. For all of you who are looking for the fountain of youth, the biggest thing is, first of all, taking care of your health. Exercising, drinking a lot of water, for example. I got to drink one of these every day. It's like a gallon of water. No smoking, SPF, sunscreen, eating properly. You got to take care of yourself. And of course, the biggest thing that kills you is stress. So you got to do all those things. And that's the biggest part of Fountain of Youth. In addition, you got to start taking care of your skin early. So I want the tweens and the teens to start early taking care of their skin. They got to be healthy. And then, of course, as you take care of your skin, your elasticity of your skin is going to be better. Overall, you will look better. And of course, for the Fountain of Youth, when you need a little pick-me-up, we're here for you. Just don't overdo it. Our goal in aesthetic surgery is making someone look pretty much just like they never age. We don't want them to make them look different. We just want someone to always look good. Now, from the reconstructive standpoint, especially with the nose, function is so important. So from the Fountain of Youth, just do it and start early and do it very naturally. And if you do need some type of plastic surgery, just make sure you go to the right doctor with the proper credentials and with the best experience.